Take it to Harrisburg with Acting Health Secretary Alison is talking about the Johnson & Johnson vaccine.
Joining me for this call and will be prepared to answer questions, particularly clinical questions, leveraging her expertise. Keep in mind that this is an emerging issue and we may not yet have all the answers to all of your questions. Today, the Pennsylvania Department of Health notified vaccine providers to pause administering doses of Johnson & Johnson until at least April 20th. This notification followed the recommendation released earlier today by the Centers for Disease Control and Prevention and the Food and Drug Administration. The CDC and the FDA put this pause in place to review 6 incidents of rare blood clots that occurred within 2 weeks of individuals receiving the Johnson & Johnson vaccine. An emergency meeting of the Advisory Committee on Immunization Practices, which will be held tomorrow, will further review these cases and provide more information on next steps. All 6 of the cases occurred in women between the ages of 18 and 48. Preliminary information indicates that none of these 6 cases occurred in Pennsylvania. However, we are awaiting confirmation from the CDC on that point. To date, 6.8 million Americans have received the Johnson & Johnson vaccine. That means that 1 in a million people receiving this vaccine have been affected by this issue. However, safety is our paramount concern, and we are taking these steps out of an abundance of caution. We understand that this announcement may be challenging for those who are looking to get vaccinated, as well as those who have already received the Johnson & Johnson vaccine. However, I want to emphasize that this action highlights the federal process which monitors the safety and the effectiveness of the COVID-19 vaccines, which is working. We have said these vaccines would be the most scrutinized and watched vaccines ever in history, and this step reflects this. The action today reflects the federal government's commitment to protect Americans. The protocols in place should give Pennsylvanians confidence in the safety and the effectiveness of the Pfizer and the Moderna vaccine. I want to emphasize that all Pennsylvanians should proceed with getting vaccinated as soon as possible to fight this virus. Individuals who have appointments scheduled to receive Pfizer or Moderna should keep their appointments. If you are not aware of which type of vaccine you are scheduled to receive, it's important to emphasize that providers will not be administering Johnson & Johnson vaccine over the next week. If you received the Johnson & Johnson vaccine and have health concerns, you should contact your healthcare provider. Individuals who received the Johnson & Johnson vaccine within the last 3 weeks who develop a severe headache, abdominal pain, leg pain, or shortness of breath should contact their healthcare provider immediately. The department has sent messaging to a number of other groups who received the Johnson & Johnson vaccine as part of special vaccination initiatives. We will continue to share information to ensure Pennsylvanians are informed about the available vaccines, and we thank you for your time today. Dr. Johnson and I now welcome questions.
Thank you. Our first question is from Michael Rubenkamp from the Associated Press.
Secretary, I'd like to get your reaction to what the CDC director said yesterday in reference to the surge in Michigan. She called for that state to really close things down, go back to where they were last spring and to shut things down. Pennsylvania has one of the nation's biggest surges. Does the Wolf administration have any appetite to, quote, shut things down again, as the CDC director urges? Is that practical?
Thank you for that. And this is time to really focus on all of the measures that we can take to be able to go on the offense and control against the spread of the variants, further cases increasing, and having to ever put in place any other mitigation efforts, which we do not want to do. Ultimately, it's up to us to remain masked. It's up to us to socially distance and really remember to get vaccinated when you're able to secure those Pfizer and Moderna appointments, especially right now. And so we'll continue to evaluate, but this really highlights the need for all of us to take self-responsibility in making sure we have those actions to prevent further spread of the virus.
Up next, we have Chris Mamula from the Post-Gazette.
Hi, Secretary. Thank you very much for taking my question today. I'm wondering if you can provide an approximation of the amount of Moderna and Pfizer and J&J vaccine Pennsylvania was scheduled to receive this week.
Yes, I can do an approximation. I believe that I know the Janssen vaccine was 20,000 doses that were going to be received this week. I believe Pfizer, the Pfizer and Moderna was 157,000 Pfizer and 170-ish thousand of Moderna. But our team will follow up if there's any. 270,000 total is the math there. But our team can follow up on that front too.
Thank you. Next, we have Hayden Mittman from PBS 39.
Hi, I'm curious about educators. I know that they were targeted with the Johnson & Johnson vaccine. Have we gotten through Pennsylvania's education system? Have they all been vaccinated with the Johnson & Johnson vaccine? And should they have concerns? Should they have issues because of the recall or the pause?
So we had an opportunity to use those initial Johnson & Johnson vaccine allocations to absolutely remain committed to vaccinating our teachers. Those clinics have concluded at this time, and so our teacher population clinics are wrapped up, and so teachers who wanted to get vaccinated have been vaccinated. And I think by way of the question of, is there cause for concern, I'd actually like Dr. Johnson's weighing in here from the clinical perspective, which is probably best situated to respond to that aspect.
Thank you. Well, from the information that's been available, that's been coming out today, it seems like these 6 cases occurred within 2 weeks of the J&J vaccine. The people who have been vaccinated well past that time, we haven't seen those cases. So there shouldn't be worry for people who have been vaccinated more than that time. And if it's been less than 2 weeks and those severe symptoms do occur, they should seek their healthcare provider.
Thank you. Up next, we have Tom Lehman from WGAL.
Secretary, I think you kind of spoke a little bit to this when you were talking about people, if they know which vaccine they were supposed to get. But can you break it down a little bit further? If you know you were going to get Johnson & Johnson, or if you or believed you were going to be getting it, what information should people be looking for providers? What should they know going forward? And who should they be looking for that guidance from about rescheduling or substituting a different vaccine?
Sure. And so just by way of whose guidance are we going to be following, clearly there's federal guidance that's emerging continuously. And so we are closely monitoring what the federal government has advised as well. But specific to Pennsylvanians who may have had that Johnson & Johnson appointment, or they have a suspicion their appointment was going to be using that Johnson & Johnson vaccine, we do encourage them to speak with that provider. And if the provider is able to reschedule with another Pfizer or Moderna vaccination, excellent. If not, they should actually find another appointment.
Next, we have David Winter from Penn Live.
Thank you. Secretary Beam, you've mentioned several times in the last week or so, your concerns about the vaccine hesitancy and the need to overcome that. Now we have this. My question is, what impact does this have on that, and what is your message to people who would perhaps become more hesitant because of this news? Thank you.
Thanks, David. And actually, Dr. Johnson is spearheading a lot of our hesitancy work. And so, Dr. Johnson, would you like to speak to that?
Sure. Well, I believe that, as Secretary Beam has already mentioned, there's been a high level of scrutiny of this vaccine. And so that even though there are only 6 cases that have come to our attention, we have this pause so we can evaluate closely to see what other actions need to be taken. So I believe that people should feel more confident that we are scrutinizing this process so closely, much closely than we've ever done with any other process like this.
Next, we have Tegan Simonton from the Pittsburgh Tribune-Review.
Yes, hi, Secretary. Thanks for taking my question. Understanding that the state just opened up vaccine eligibility, do you expect this temporary pause to affect the availability of appointments across the state?
So as you mentioned, we've aggressively gone through the phases to allow, at this point, universal adult eligibility for Pennsylvanians to again, schedule that appointment. Much of that scheduling really was reliant upon the Pfizer and the Moderna predictability, primarily because those are the allocations that have stayed steady or incrementally increased week over week. The availability of the J&J vaccine has fluctuated, as you all well know. And so what we really trust at this point is that our provider community, again, can continue to rely on the Pfizer and the Moderna allocations and be able to schedule all of those Pennsylvanians that are interested in getting vaccinated, which really was a piece of kind of progressing through those phases as quickly as possible to get folks scheduled appointments.
Next is Seth Kaplan from ABC 27.
Hi, Secretary Beam and Dr. Johnson. Wondering if back to the rarity of this. So, I mean, you can appreciate that there are people who see the CDC and the department kind of walking a line here saying this is 1 in a million. I mean, are 1 in a million blood clots or people getting a blood clot at a rate of 1 in a million, is that just common anyway, vaccine or no vaccine? And I guess I'm just trying to understand from your view, in terms of listening to the CDC guidance and now embracing it, what is the evidence here that this, or at least the potential here, that this was related to the vaccine that rose to the level that this was just more than, hey, some people get blood clots every day in America anyway?
Well, blood clots are a lot more common than we are seeing here, the 1 in a million. I think the thing that is really concerning is that these blood clots are occurring with low platelet levels, and that's not something that we see very commonly. I believe that the CDC and FDA came out to put a pause on this so that we could really evaluate what is going on here, and to also make sure that providers, when they see these patients, that they are treating them appropriately. Because normally when we treat blood clots, we treat them in a way that could increase their risk if these patients with low platelets are presenting. So they really wanted to heighten the alertness of providers who might see these patients.
Up next, we have Justin Schweitzer from the PLS Reporter.
Hi, Secretary. I wanted to see if you could touch on the federal recommendation itself and the impacts of that, given that, you know, the side effects were experienced by 6 known people right now. Do you think that recommendation by the FDA and the CDC to halt the use of the J&J vaccine was justified, given that there were roughly about 7 million shots administered nationwide and only 6 people experienced those side effects?
So we really are looking at an unprecedented vaccine rollout and the scrutiny applied to it. And I think this goes to show that the federal government and the state are so closely monitoring any adverse events following a vaccination, because we want to make sure that the safety and the efficacy around these vaccinations are something that folks really have trust in. And so really the federal government's action is prudent to allow us to retain the trust around the vaccination process as a whole, and again, get as many Pennsylvanians and as many folks in the country vaccinated as quickly as possible.
Up next is Jeff Rushton from statecollege.com.
Thank you, Secretary. Can you tell me, what does this mean for the regional vaccination center at the Bryce Jordan Center?
Sure, and thank you for highlighting the regional commitment. We really, at this stage, are going to be prudently pausing the regional vaccine clinic, specifically at the Bryce Jordan Center. As you know, that's done in partnership with the local community leadership as well as PEMA. And as soon as the federal guidance was issued, we likewise followed suit and paused that clinic at this time until we await further guidance from the federal government.
Up next is Harry Lee from Fox 43.
So I know that there are 6.8 million Americans who have gotten it. Do you know how many Pennsylvanians have gotten the Johnson & Johnson vaccine? And also, how concerned are you that this will increase vaccine hesitancy?
So to the first question, 262,739 doses of the Johnson & Johnson vaccine have been administered in Pennsylvania. As Dr. Johnson really articulated so saliently, of course we are concerned about hesitancy. We have been very clear on our concern that we have to make sure that we get the critical mass of Pennsylvanians vaccinated. So again, we can go on offense against any sort of spread of the virus or any sort of threat posed by the variants. What we hope, though, is that folks really understand the true takeaway here is that what the federal action that was taken today is really indicative of our dedication to making sure that this entire process is monitored so tightly and with such integrity that folks really can trust in the vaccine that they are getting. And we hope that continues with the Pfizer and the Moderna vaccine while we have the Johnson & Johnson vaccine on pause.
Okay, our last question is going to be from Lizzie Hardison from Capital Star.
Hey, thank you. I just wanted to ask, I'm still trying to understand how the Johnson & Johnson supply was integrated into the state's just general vaccine supply after the educator mission completed. Are there certain communities that are getting more J&J doses than others? Or are there certain places where you think that the impacts of this will be felt, most acutely?
Sure. So just high level, we just had really that infusion of the Johnson & Johnson vaccine. And after the educators and the child care workers were vaccinated, there was a twofold mission. First, we went to our frontline workers and we allowed our law enforcement, our firefighters, our grocery store workers, and really those in the food and the agricultural processing industry to be vaccinated. And many of those clinics are just ramping up right now, some of which have not actually opened their doors yet. Secondarily, we had a regional initiative that really shifted to allow regional leadership across the Commonwealth to choose what is the best administration manner for their communities. And so, as mentioned previously, in the center, the northern center tier, that's going to be a regional mass vaccination site. But in some of our regions, they've chosen to just infuse it into the county municipal health departments or into the existing provider network. And so they're really, on the regional initiative, it's different by way of what the local leadership had chosen to do. And that's going to be indicative of where the Johnson & Johnson vaccine is available in those communities.
Once again, thank you for joining us.
We have been listening to the Acting Health Secretary and Acting Physician General update, the COVID-19 vaccine rollout here in Pennsylvania. And the big takeaway, out of an abundance of caution, the DOH will pause the administration of J&J vaccines in Pennsylvania until at least April 20th. Now, this follows recommendations from the CDC and the FDA, who are currently investigating. So it's important to put it in context that 6 incidents of rare blood clots taking place between 6 and 13 days after immunization have happened. That's 6 women out of 6.8 million J&J doses administered across the country. They were all women ages 18 to 48, none that we know of in Pennsylvania. 263,000 of the Johnson & Johnson vaccines have been administered in the Commonwealth. The Acting Health Secretary advises Pennsylvania should continue to be vaccinated. It's also important to know that you will not be getting a Johnson & Johnson vaccine for at least the next week. And those who got the Johnson & Johnson vaccine within the last 3 weeks or so who do get significant side effects should be contacting their doctors. That, of course, includes teachers across the Commonwealth who have gotten the vast majority of those doses in Pennsylvania. It's important to know, though, those teachers have already passed that 6 to 13 day time frame of concern. We'll have much more coming up on this story tonight on Fox 43 News First at 4. If you do have continuing questions about the vaccine, Fox 43's got you covered. Just text the word vaccine to 843-0043. We will send you a link to our COVID-19 vaccine guide. which includes information about the vaccine's distribution, any possible costs and eligibility. Again, make sure you are sending a text message to the number and not calling it. I'm Evan Forrester. We'll see you coming up in about an hour and a half for Fox 43 News, first at 4.